This is Dr. Emma Nichols, and this is the information on the latest U.S. FDA approvals for June 3rd through June 7th, 2024. I hope you're having a great week and your summer is getting underway. The kids are out of school, no? Mine's left home already, so I don't have to worry about that. All right, so the FDA has approved tirbanibulin, also called Klisyri, for the treatment of actinic keratosis on larger areas of the face or scalp up to 100 centimeters squared. Klisyri was initially approved in December 2020 for treating actinic keratosis on areas up to 25 centimeters squared. Klisyri is a microtubule inhibitor ointment, which is now available in a 350 milligram package size for a 5-day topical field treatment of actinic keratosis. Actinic keratosis is the most common precancerous dermatologic condition with a prevalence of 11% to 25%. It is the second most common diagnosis made by dermatologists in the United States. The approval was based on findings from an additional phase 3 multicenter trial involving over 100 patients. The study evaluated the safety and tolerability of applying this agent to an approximately 100 centimeters squared area on the face or balding scalp of adult patients. Results were consistent with the original pivotal trial, showing a similar safety profile for local skin reactions and treatment-related adverse events. The effectiveness of Klisyri in reducing actinic keratosis lesion count was also confirmed in the larger treatment area. The approval of Klisyri was granted to the manufacturer Almirall. Also this week, an advisory panel to the Food and Drug Administration voted 10-1 last week against endorsing the overall benefits of the psychedelic drug MDMA for post-traumatic stress disorder (PTSD) treatment. The FDA panel highlighted issues such as flawed study data, questionable research practices, and notable drug risks, including potential heart problems, injury, and the potential for abuse. While the FDA is not obligated to adhere to the panel's recommendations and will make its final decision on August 11th, the negative feedback could bolster the agency's rationale for denying the treatment. The proposal to use MDMA, also called ecstasy or Molly, for treating PTSD faced substantial criticism, marking a potential setback for proponents of psychedelic therapies aiming for federal approval and mainstream medical acceptance. MDMA is the first among a series of psychedelics, including LSD and psilocybin, anticipated to be reviewed by the FDA in the coming months and years amidst renewed interest in the medical potential of these substances, which advocates believe could revolutionize mental health treatment. During the advisory panel meeting, concerns such as flawed studies that may have biased the results, missing follow-up data on patient outcomes, and a lack of diversity amongst participants were noted. Lykos, the company developing this agent, said in a statement after the meeting that it would work with regulators to address the panel's concerns. According to a report from the Associated Press on this meeting concluded with several experts encouraging Lykos and the FDA to continue studying psychedelics for PTSD, citing the field's potential to help patients. Also last week, the FDA approved respiratory syncytial virus vaccine adjuvanted, also called Arexvy, for the prevention of RSV, lower respiratory tract disease, in adults 50 through 59 years of age who are at increased risk. Previously, Arexvy was approved in May 2023 for use in adults aged 60 and older. The RSV vaccine contains recombinant RSV glycoprotein F stabilized in the pre-fusion conformation, combined with GSK's proprietary AS01E adjuvant. RSV is estimated to cause 42,000 hospitalizations annually in adults aged 50 to 64 years. Adults with underlying medical conditions such as chronic obstructive pulmonary disease, COPD, asthma, heart failure, and diabetes are at increased risk for severe consequences from RSV infection. The approval was based on findings from the phase 3 trial evaluating the immune response and safety of the vaccine in adults aged 50 to 59, including those at increased risk for RSV, lower respiratory tract disease, due to certain underlying medical conditions. The approval of Arexvy was granted to the manufacturer, GSK. And now a word from the supporter of this podcast, Nascent Medical. Attention all businesses in need of exceptional medical writing support. Nascent Medical is the solution. We are a team of skilled MD and PhD level medical writers who specialize in fast turnaround needs assessments, manuscripts, slide decks, ad board summaries, and more. Don't settle for anything less than excellence when it comes to your medical writing assistance. Visit nascentmc.com. That's nascentmc.com. We're here so that you never have to be without excellent medical writing help. That's nascentmc, as in medicalcommunications.com. Also last week, the FDA approved imetelstat, that's also called Rytelo, for the treatment of adult patients with low to intermediate 1 risk myelodysplastic syndrome, that's LRMDS, with transfusion-dependent anemia requiring 4 or more red blood cell units over 8 weeks, who have not responded to or have lost response to or are ineligible for erythropoiesis-stimulating agents, ESAs. Imetelstat is a first-in-class telomerase inhibitor, marking a novel approach to treating LRMDS. Telomeres are protective caps at the ends of chromosomes that naturally shorten each time a cell divides. In LRMDS, abnormal bone marrow cells often express the enzyme telomerase, which rebuilds those telomeres, allowing for uncontrolled cell division. Lower-risk MDS is a progressive blood cancer characterized by transfusion-dependent anemia, which significantly impacts patients' quality of life and survival. The approval was based on results from the iMerge phase 3 clinical trial, which demonstrated durable and sustained red blood cell transfusion independence, increases in hemoglobin levels, and reduction in transfusion burden across key LRMDS subgroups. In the iMerge trial, 39.8% of patients achieved transfusion independence, or at least 8 consecutive weeks, compared to 15% of the placebo group. For at least 24 weeks, 28% of patients treated with imetelstat achieved transfusion independence compared to 3.3% in the placebo group. The approval of imetelstat was granted to Geron Corporation. Also last week, the FDA approved a dose increase for amifampridine, also called Firdapse, from 80 milligrams to 100 milligrams for the treatment of adults and pediatric patients weighing more than 45 kilograms with Lambert-Eaton myasthenic syndrome, also called LEMS. LEMS is a rare autoimmune neuromuscular disorder characterized primarily by muscle weakness of the limbs. Amifampridine was initially approved by the FDA in November 2018 for patients with LEMS aged 17 or older, with an expanded indication to include patients as young as age 6 in 2022. The drug is a potassium channel blocker which works by increasing the release of acetylcholine at the neuromuscular junction, thereby improving muscle strength. The approval for the increased maximum daily dose was based on findings from the clinical trials, including Phase 3 LMS-002 and LMS-003. These trials demonstrated the efficacy of Firdapse with clinically relevant improvements over placebo in the quantitative myasthenia gravis QMG score. The latest approval of Firdapse was granted to Catalyst Pharmaceuticals. All right, that's it for this week. If you're a medical writer or editor, or you are in the industry and you actually write about medicine sometimes for whatever your job role includes, then please visit learnamastyle.com. That's learnamastyle.com. There's all kinds of free downloads, including an AMA style guide. There's a free course on implementing AI in your work and lots of other free downloads. So check that out, learnamastyle.com. Thanks so much, and I'll be back next Monday with all the latest FDA approvals. I hope you have a wonderful week.